Come in.
Hi there.
Hello.
Hi. I'm Dr. Michael Morrow.
Hello.
I'm one of the breast radiologists.
Okay.
How are you today?
I'm nervous, but I guess I'm ready.
Okay, you're nervous? Well, I have some news for you that might be a little bit not what you're expecting. I don't think we're going to need to go forward with your biopsy today.
Really?
Yes, so I took a look at the images. We took some screening images to get ready for the biopsy.
Right.
And I saw that some of the calcifications later, which is basically jargon for us, and it shows that they're benign. So I don't see a need to move forward with the biopsy.
So you're not going to do it now?
No, I do not think we need to do it. So that's good news.
I guess. I mean, I'm relieved, but kind of, why did they send me here? Like, how do I know to believe you that you say they're benign when the other radiologist sent me here?
Yeah, that must be confusing, huh?
Yeah. I mean, he made a big deal. He called me personally and said, I really want you to come here.
Right. So, and he felt concerned enough that you should get a biopsy.
Yeah.
Well, I even went back and looked at the screening mammogram, and I think they are there. I think it may be tough to see, so I can't see, what I do see is that what these are very typical for benign calcifications and nothing that needs to be followed up. So basically, the characteristics are such that there's really no question about them. And I think that it's good news for you. And you can be rest assured, I'm happy to go over the images when we're done speaking. I'm happy to go over them and show you exactly what I'm talking about. It's kind of
that might help because
yeah.
I don't even understand. I think the other, the other radiologist said calcifications too. And I think, frankly, I didn't really understand what that meant.
Right. Without getting too much into it, there's all different kinds of calcifications. Some are concerning, some are indeterminate, and some are classically benign, and ones that we don't need to worry about. And the ones that I'm seeing on you that were recommended for biopsy are classically benign, and I'll show you exactly why I say that and the characteristics.
That might help me.
Yeah, we can go.
Realize that I should believe you and not Dr. Smith. I guess it just worries me that now I have these two different opinions. I mean, I'm thrilled that I don't have to go through with the biopsy.
Yeah,
but
and I'm happy to talk with him as well, just to go over the images. We can go over them together if whatever would make you feel most comfortable. I know it's probably easy to say, oh great, I don't have to do a biopsy,
right.
But that must be confusing for you. So
well, it's just I got really anxious when they said I had to have one, and then I kind of worked myself up that I would go ahead with it. And my husband took the day off, and he doesn't even get paid for today to come in with me, but I wanted him here.
I imagine. I'm sorry about that. So I hope that wasn't too much of an inconvenience, but I think in the long run it's always better not have to have the biopsy. But whatever will make you feel comfortable, I want to make sure that we kind of answer that question for you. So whether it's, like I said, I'm happy to go over the images with you.
Okay, that might help.
I can definitely do that for sure right now.
That would be the best, I think, if I could just see and you could point and say, because
for sure.
The other radiologist didn't do that. They just said, this is what I saw and this is what I'm worried about,
Right. And
go and have the biopsy.
Exactly. So you mentioned a doctor's name. Was that the radiologist who read your other mammogram?
Yeah.
Okay.
So he's the one who called me.
Yeah. And I'm happy if I can get a hold of him. I'm happy to try to get a hold of him so we can maybe discuss the case together before we look at the images, and then I'm happy to, like I said, show you what I see and why that we do not need to do the biopsy today.
So what does that mean for follow-up? Like they just did those extra images just now. Do I come back here or go back to the place where I usually go for mammography? From
here on out, so kind of two things, if I understand your question right, and if not, just ask me again. So I think the recommendation would be just to return to routine screening at this point. These are benign, there's nothing else we need to do about them.
Okay.
And then you just come back in a year or whenever
That's what I usually do
when your normal is. Now, whether you go there or here or whatever, that's up to you. as to where you get it done. But I would recommend you continue to get screening.
No, oh, definitely.
How you
I
do
know, this
that,
really
yeah.
scared me, yeah.
How you
yeah.
do that is your, that's up to you
Okay,
and where you see
2
best.
minutes remaining.
okay, all right. Well, that is quite a relief.
Yeah.
Um,
What other questions do you have? Any concerns?
So will this put me at a higher risk for developing something? You said you're absolutely sure this is benign, that
Yeah, these
it has
are-
the characteristics
Yeah,
that,
these are very characteristic, and these are not anything that predispose
Okay.
you to cancer. So
okay, that was my question.
you're at no greater risk now having these than you were
Mhm.
before.
That's what I meant,
Yeah.
okay. No, I think that's quite a relief.
Okay, well, great. Let me go do some searching. Like I said, if you want me to try to contact him first, I can. If not, we can just go straight and look at the
I'd like
images.
to look at them,
Okay.
because I understand it might be difficult to get him on the phone.
Yeah,
or
for sure.
whatever.
Yeah, so let me go make sure we get your images up and in a room where I can do that with you, and
Okay.
we'll get that done.
Thank you so much.
Okay, yeah, nice
Thank
meeting you.
you.
Thank you.